Hello, everyone, and welcome to another edition of Our Health, Our Community. It's a partnership between WNDI Radio and Sullivan County Community Hospital. Again, our program airs every third Friday here on WNDI. You know, statistics show that on average, men live about 5 years less than women, and many of the leading causes of death are actually preventable. Now, this June, we are shining the light on Men's Health Month to close the gap. We're joined today by Dr. Eric Heath of Sullivan County Community Hospital to discuss the silent warning signs men often miss and the screenings that are changing the game for local patients. Hello, Doctor. Nice to have you here.
Hello.
Let's talk about this. There's a lot of things we want to go over here, Doctor. But men often take better care of their trucks than their bodies. Why is a wellness visit more than just a checkup, and what's the danger of waiting until you feel broken before you see a doctor?
The problem with men's health is, and general health, is that a lot of these problems are preventable or curable if found early enough, and we often neglect our bodies. We just kind of don't pay attention to the little warning signs. So it's good to get in to see your doctor so that they can, evaluate you, do a checkup, check any blood things that need to be checked, and get a plan going forward on how to keep you healthy and living longer and healthier longer.
You know, they used to say that the age 50 was the magic number to get colonoscopy. Now, that has changed. Why is 45 the new 50?
Well, we're seeing colon cancers popping up earlier in people these days. We don't really know why, but it has definitely been the trend forward. I've seen people in their 30s with, severe colon cancer. So colon cancer, we're seeing it much earlier in people these days. So they had dropped the standards in the last several years down to 45 so that we can start getting these earlier cancers, getting the cancers early so that they're treatable. A lot of times the cancer start off as a polyp. We can get in for a colonoscopy, get that polyp taken out so it doesn't have a chance to grow into a cancer.
Very good. You know, high blood pressure and cholesterol are often called silent killers, Doctor. What are the top 3 numbers that men should always know by heart?
They should know their blood pressure. Our goal would be 120/80. They should know their LDL, which is their bad cholesterol. As physicians, we really don't look at cholesterol anymore. We look at the LDL and the HDL and that ratio on how healthy you are from a cardiovascular standpoint. And then the last thing you should know is your A1C. That is an average of your last 3 months of your blood sugars. Okay. Tells us whether you're diabetes or you're trending towards diabetes.
You know, why is waist circumference, or they call it belly fat, such a critical predictor of heart disease for men?
Metabolically active fat in the gut it kind of surrounds everything, releases inflammatory factors which negatively affect the cardiovascular and the cerebrovascular health. So whenever you have increased abdominal girth, you're going to have increased release of inflammatory factors which are going to predispose you to heart disease and stroke.
We're talking here with Dr. Eric Heath. This is Our Health, Our Community here on WNDI, and also a partnership with Sullivan County Community Hospital. At what age should men start the conversation about prostate health, Doctor, and PSA testing?
In general, the age is 50, but if you're Afro-American or if you have a family history of prostate cancer, you may want to start at age 45.
Okay. And why so early? Is it just because of the way people eat these days? Is that a large part of it?
I think a lot of it probably is not necessarily the way people are eating, but what we're eating. I think the food supply is less healthy today than it was 50 years ago. There's so much more processing that's going on with foods, additives, preservatives, new herbicides, pesticides, whatever may be the case.
I think that you're definitely right on that. We see a lot of commercials these days, Dr. Heath, for low T. So how do we know if fatigue is a hormone issue or just a lifestyle? And why should we see a doctor before trying supplements?
Well, in general, the supplements may raise your testosterone, but they're only going to raise them minimally. So anyone that is probably on that, probably it's a placebo effect from taking those medications, in my opinion. So you need to see your doctor about fatigue because there are so many causes of fatigue. It could be thyroid, it could be anemia, early signs of colon cancer where you're having some silent bleeding in the colon. It could be diabetes, it could be obstructive sleep apnea. Several things can be causing it, and low T was kind of minor on the whole process. We can treat low T, but if there's another underlying problem, even mental health, that is causing your fatigue, then the low T may mask it over and make you feel better once we put you on testosterone replacement, but it's not going to get to the problem, and that problem is going to grow, get worse, and be much harder to treat down the road.
Okay, so during Men's Health Month, Doctor, what is your most important advice for men who may be listening here?
Get in to see your doctor. If you don't have a doctor, we have a few new providers here at Sullivan County Community Hospital that are accepting new patients. And get in there, get your checkup, get checked out, and make sure that you're going to be as healthy as long as you can be.
This has been another edition of Our Health, Our Community. It's a partnership between Sullivan County Community Hospital and WNDI. Today's guest has been Dr. Eric Heath. Doctor, thank you for your time.
Thank you very much.
Again, I'm John Montgomery. Until next time, we'll see you on the radio.